All right, we proceed with this conversation tonight, this morning rather. It is now 15 minutes to the top of the hour. My name is Ram Maguko. Thank you so much for sticking with us. This is Good Morning Kenya. It's a pleasure being with you today. And as I promised you earlier on, let's take a look at matters concerning the state of healthcare in the country. This is all about matters concerning healthcare as we talk about how far we are as a nation when it comes to attaining proper, successful, affordable, and accessible healthcare. Well, to help us in this conversation this morning, I'm with Dr. Samson Misango, the program director for the College of Surgeons, East, Central, and Southern Africa, known as COSESCO.
COSEXA.
Karibu sana daktari.
Asante sana.
I hope you're well.
I'm well.
First things first, I know that there are so many things we want to tackle, but let me, for you, so that you can know exactly what I'm looking forward to this morning, there is an interesting discovery that I just recently made. Laparoscopy. Catch that word. Laparoscopy. Now, there is a type of surgery known as laparoscopic surgery that has less pain, get that, less pain and less hospital stay. What is this all about? We'll be taking a look at that in a bit. But how has healthcare been for you? Has it been expensive? Has it been achievable for you? Do you have access to it? Let's talk about this. Let's engage. The hashtag is Good Morning Kenya at Ram Maguko. The official station handle is at KBC, Channel 1. Daktari,
yes,
first things first, let's take a look at some of the state of affairs in the healthcare sector as a nation. How far do you see as a nation, before we tackle many things, just your opening remarks, do you feel like there is still a lot that needs to be achieved in the healthcare sector?
Thank you very much, Ram. From a personal point of view, there is a lot that actually needs to be attained in terms of healthcare provision in the country, not just in the counties, because we cannot take Kenya in isolation. Kenya is part of is one of the developing nations, and there are several challenges that afflict us in health. As you know, since the health was devolved with the new constitution, counties are the ones who are managing healthcare in the country.
Yes.
And there have been a lot of concerns about how services are getting to the public, a lot of concerns about how resources are being used, a lot of concerns about how healthcare personnel are being managed. And this all, when you put it in the context of the government's agenda of universal health care, which is supposed to be affordable to all citizens in Kenya, puts a lot of responsibilities of the country's resources on how health is managed. So we cannot just sit back and look at the government to be the ones who are going to provide the solutions. We look at all the individuals in the healthcare sector, private, mission hospitals, government institutions, non-governmental institutions. They're all coming together to try and provide what is called affordable healthcare to the public. And that is where we come in as part of an institution that is purely is an initiative of the private with donors to come up with ways of ensuring that people in the public sector get training. And with the training, of course, we have what is called a sustainable program in health that is going to be able to go into the very small villages and small counties where previously healthcare was a mirage.
You've mentioned affordable healthcare, but now the question is it really affordable? I'm looking at the medical expenses that are there that Kenyans incur in accessing healthcare and surgical care as we know it. Is there a solution towards this? How can we ensure that healthcare is more affordable and more accessible?
It is possible as long as there's goodwill. It all comes back to goodwill, because If you consider some of the important sectors of our economy or of our governance and of our republic, you talk about security.
Yeah.
In practically every small village you go to, you'll find a police station. In every small village you go to, you'll find an established healthcare center. Okay, this one structure that were put, I think, even before independence of Kenya.
But still, there are some villages where people still go so many kilometers before they get the nearest healthcare facility.
Yes, this is because there has been a disconnect between the population growth, expansion of cities, expansion of people, and the goodwill of successive governments in ensuring that basically the basic healthcare is available to every citizen in the country, in those places. But when you look at the initial design of the country, healthcare, education, security were basically running together. That is why growing up, we used to know if you're getting stuck anywhere, you just need to mention the nearest police station.
Yes,
and you
yes,
get direction.
Yes.
Okay. The same thing, you'd just mention the nearest health center, and people would know where you are as part of a landmark. These were called landmarks in Kenya. But I think what has happened is over time, we have grown in a capitalistic way, such that people are no longer focusing so much on delivery of healthcare, but basically profit making. And that, I think, is what has caused a disconnect between delivery of healthcare services and availability of the healthcare services. My personal opinion.
Yes. And I'm grateful for that particular thought, because we are looking at interests that are there within the healthcare sector. But now the person that is suffering is the Wanjiku at the ground.
Right.
They cannot afford some of these things. Give me your thoughts in regards to this. The availability of medical supplies, the availability of medical equipment in the country. From where you sit, you have managed to be on the ground as a high-profile individual in terms of the healthcare. And what is your take in regards to this particular area? Is there available or sufficient resources?
Well, first of all, let me introduce myself properly. I'm actually an assistant director, senior assistant director of medical services in the government of Kenya. I'm the head of surgery at Kiambu Level 5 Hospital. I'm the program director of the College of Surgeons East and Central Africa, that is COSEXA in Kiambu Level 5 Hospital. I'm also a private practitioner in Kenya at the Meso Center, and a philanthropist, because I do a lot of work that basically adds value to society. Now, to answer your question now, since I've been involved very much in the county as somebody on the ground,
exactly.
We call ourselves Watu wa Mkono. My work is to take care of the county patients. So we run clinics in the hospital. We do ward rounds. We take care of patients. We go to theater under very harsh conditions, because you see, we rely on our employer to provide facilities, and then we work. I think anybody who is, we're not strangers in Kenya, and we know that these challenges which afflict us cannot be solved by blaming different people. So Wanjiku is caught between a rock and a hard stone, because on one hand, the politician tells Wanjiku that healthcare is available, is accessible, it is free in the public facilities.
And the resources are there, the drugs are there.
The drugs are there. You see, that is the nature of politics. Now, on the ground, we have to deal with these patients' expectations, because patients come knowing what they saw on TV, and they're being told in gatherings that this is available. So when they come to us, we have to give them what it is, which is realistic. So we have to split our time. Sometimes we use our own personal resources to be able to provide for these needs, because if we don't, and they make a complaint to any of the people who are in authority, the easiest response is, Daktari wameiba madawa. Okay? That's a common response.
That's a common response.
It's a very common response from politicians.
Daktari wameiba madawa.
Yes.
Wow.
You know, we usually say, we wish these medicines were there to be stolen. Okay.
But they're not there.
They are not there. Different counties have come up with ingenious ways of providing, of ensuring that these resources are available. But there's always a short, because the supply cannot take care of the demand of the counties.
Because of the population.
The population, yes. Take for example, where I come from at Kiambu level 5, we have several sub-district hospitals, what were previously called sub-district, now they're called sub-county hospitals,
yes, yeah.
scattered all over. But because of the infrastructure in those particular units, a lot of patients will be referred to either Kiambu or Thika. The same thing will happen in Nairobi. Because of the concentration of resources in the level 6 hospitals, which is KNH, Kenyatta National Hospital,
yeah.
Mbagathi, not Mbagathi, Madari, and Spinal Injury Hospital. Anybody who is coming with a condition that would be otherwise handled at a basic facility, they end up being referred, because either maybe there's lack of personnel or lack of equipment. Now, sometimes very, very well-intentioned projects like the medical equipment services that was initiated about 9-10 years ago, it ends up being a money-wasting enterprise or exercise that people just end up taking, but the people on the ground are not getting the services. Why? Because it's a policy which is initiated by somebody sitting in an office and thinking they're basically giving good services. However, what we end up realizing with time is that we have very good equipment in some particular places, very good equipment, but the personnel either are not there, or when the personnel are there, then some of the equipment, we do not have people who can basically be able to manage them. And this is one of the challenges, I suppose, which we end up experiencing in our healthcare delivery system, in terms of trying to get what Wanjiko requires,
yes,
at an affordable cost.
All right.
Now, we have what is called NHIF, which is one of the vehicles that has been designed to ensure that wananchi get affordable services, and it works. It works. The only challenge sometimes in the public health sector is the private sector is in competition with the public sector.
The public sector.
And that being the case, you find if a patient has NHIF and a facility is not available in the public health sector, he has the option of going to the private. And when a patient is given the choice of public versus private with the same personnel, he knows in his mind that he's going to get better services in the private. So it becomes a choice for him to make, because the challenges in the public sector are many.
But then this disconnect between public and private health facilities, it can be mended, right?
Yes, with goodwill.
With goodwill.
Yes.
Then this perception that the private sector is better than the public sector is something that will take time for it to be eradicated.
It will take a lot of time.
A lot of time. Many years.
My take in this is, I have a very simple solution. If somebody is listening to me, I'll just say, the way to basically ensure that the public gets the necessary confidence in the public facility is to ensure people who are running public health facilities and public services are basically using those services themselves. Because it does not make sense. It does not make sense. It does not make sense to give somebody responsibility over a facility
he's in charge
that
of
he's
the
not
facility.
using. He's in charge of the facility, but he is not using it. Because that is where we are now as a country.
Because you can only know the kind of food that is in your house if you only eat it.
If you eat it. Yes.
Dr. I want us to take a short break, and then we'll be back with more on this particular issue here concerning medical healthcare in the country. Remember, we are yet to tackle laparoscopy. Cast that word, laparoscopy. What is that all about? Let's take a break. We'll be back. This is Good Morning Kenya. We proceed with this conversation this morning. It's all about matters concerning healthcare in the country. Ladies and gentlemen, I'm with Dr. Samson Misango here, the program director for the College of Surgeons, East, Central, and Southern Africa. Dr. Thank you for sticking with us today. You've highlighted so many good things before we took that break. And in fact, you mentioned that if we are to proceed and to have progressive healthcare and service delivery to Kenyans, those in charge ought to use their own facilities, their facilities where they are in charge. And I love that. But one thing that you mentioned earlier was lack of personnel, lack of equipment. Currently, I'm looking at the KMPDU. They had issued a stern warning, and they were saying that, you know what, we may strike, and they want to issue a strike notice, talking about implementing the employment of 20,000 doctors. They are also talking about the immediate release of funds to this particular sector. What's your take in regards to that particular sentiment that was aired by the SG, that is Dr. Atela, you know, when he was saying that they need immediate action from government?
Well, I will not purport to talk on behalf of KMPDU.
Yes,
I am a member, yes, but I'm not exactly an official, but I'm a friend of the union. And their concerns are very valid.
They're valid.
Yes, as expressed. And it has to be remembered that they have not issued this warning, because it's not really a strike notice, but a warning.
A warning, yes.
In isolation. It's actually a warning which has been issued by all healthcare workers. Okay, that includes clinical officers, nurses, lab technologists, doctors, because we work in the same environment. And we normally say that a healthcare worker's environment, when you make the healthcare worker's environment good, you make the environment of the patient good. You know, you cannot remove the interest of the healthcare worker from the interest of the patient.
The patient, yes.
Yes. So the solution will not come tomorrow. I always say things begin with political will. Because as much as you might have professionals in an area who are very dedicated to their work, there has to be political will and determination to actually do things on the ground, not just talk. So if the officials concerned are able to have a sit down with these union officials and discuss how to basically take care of their welfare, not as a favor, but as required by the collective bargaining agreement, by the labor laws that exist, by the terms of agreement of the employer and the employee, we'll not be having all this, what I call union unrest matters coming in.
Because so they gave the warning, and they are saying that, you know what, if these things are not done, we will offer a notice.
Yes, and they're not coming up with demands out of the moon. These are things that have been negotiated in previous years. It's just a matter of implementation. So people sat down and agreed that these are important. People sat down and came up with terms of service. People came down and agreed that these are payments supposed to be made. Why? So that the consumer, who is the patient, can get the adequate services that they require. May it be medicines, may it be technical advice, may it be you see all the services that you get in a hospital.
So at the end of the day, what you're saying is the demands by our medical practitioners are valid, because their interests are into ensuring that the Kenyan patient who is at the hospital there is safe and confident.
And is getting what he deserves.
He's getting what he deserves.
Yes, because it is constitutionally provided for.
I'm looking at surgery accessibility.
Yes.
Still a very key area there. What do you think about the state of this particular area, surgery?
Now, there's a very big gap between the needs, the surgical needs of our population versus what is available. And I will not go into the actual figures because that will take the discussion quite far. Let me just say this, if your grandmother in the village requires surgery, she will not get it. Okay? I don't know which village you come from. I'm just assuming you're coming from a typical village in Kenya where our grandmothers stay. Okay?
But we're saying that there are very high chances she will not get it.
Yes. If a lady has an obstetric complication in some far-flung hospital in Kenya, a health center where she has been told to go to and get services, and the complication of delivery, most likely she will have what is called a complication related to labor, because she will not get the necessary intervention if she requires cesarean section. I've worked in areas like Kitui, where patients are being transported into the functioning public facility, which used to be a mission hospital, for nearly 50 kilometers on a donkey.
What?
Okay? Because that is the available ambulance that can get this patient from where she has gotten a complication to a functioning unit. And that time it had no electricity, which apart from electricity that was being provided by a generator that costs money. So what I'm saying is, if you get somebody who has a snake bite, if you get somebody who has been hit by a motorbike in the village, to get that person to a facility where they're going to get the necessary intervention to save their limb or save their life, it is a big hassle, okay? Yeah. Because the road infrastructure is poor. There's no organized ambulance transfer services. People basically use makeshift vehicles to ensure this person gets into a facility. And you get into that facility, you are not assured of what you need to get.
That is the state of affairs.
Yes, that's the state of affairs. Forget about what you see in the big cities. Nairobi, you will hear somebody has gone to Nairobi Hospital, has gone to... Okay, this is a complete, what I call, it's a smoke screen.
Let's talk about the village areas.
Right in the village.
That is where the problem is.
Yes, and then to complicate matters further, these persons in the village, when they require to get to get an upgrade on their academic or on their knowledge base, they will have to transfer from that village to the big cities to get either masters or postgraduate training or to advance their skills in their profession. So surgery is a pipe dream for a lot of people in the village.
Yeah.
Unless they're referred to the county. Currently we have level 5 hospitals in most counties, and most counties are trying to build level 5, level 6 facilities. However, healthcare is not about the infrastructure that you find. It's not about how beautiful a building is looking.
It's about the service you render.
It's about the service that you get in that facility. And that's where I think sometimes we get it wrong, because we concentrate so much on things which people can see, buildings and big signage and big gates,
rather than what people can get.
What you call the software inside there.
Now, if it's interesting and it's so ironical. I'm looking at now you're saying surgery is a problem. Accessing it may be difficult, actually is difficult, especially for those in the rural areas. But now once you access it, a lot of hospital stay, a lot of pain, a lot of medical expenses. Daktari, you know where I'm heading to?
Right.
Laparoscopy. What is laparoscopic surgery?
Now, in very simple terms, laparoscopic surgery is it's a type of surgery that is done. We call it a minimally invasive procedure. In other words, you get access into a body cavity to do our operation without having to make the cuts that we do. You see, as surgeons, we make cuts.
You make cuts. I want you to simplify
even further.
Even further for somebody who is watching us today, because the terminology may be so big and too and mouthful.
Right.
Yeah.
So I'll put it this way: the conventional surgery that the public will know about and the viewers will know about is where you go to a hospital. In other places they say unaenda kukatwa.
Ndio.
So we make a cut. If it's in the abdomen, we cut, look at your structures, fix the problem, and then bring you back together. Same thing with the skull, with the brain. We cut something where our hands can fit.
Yes.
That is the conventional open surgery. Same thing with the lungs, or the heart, or any part of the body.
As long as you have a cut?
You can have a cut which can allow your hands and your equipment to go in and fix the problem, because equipments are an extension of our hands as surgeons. Now, with laparoscopic surgery, we are now substituting our hands with some small instruments that can pierce into the body using very small cuts to just allow, like maybe this biro can go in. Now, this instrument now becomes the extension of our hands in the body without our hands having to get inside. So there's minimal access to the cavity that you want to operate. That is now called laparoscopic surgery.
Wow.
Yes.
Good discovery, Dr.
Yes. And how do we see the things that are going on there? Because we are not having vision.
Yeah, that was my next question. Yeah, good discovery, but how do you ensure that things are well? Because somebody may wonder, is this thing being manned by somebody from outside?
Right.
How are you able to move around?
The way this has been advanced, initially we used to have one of the holes having an eyepiece where somebody can peek in and see what's happening. But of course that brings errors of refraction and what your image you can receive. Exactly. So now what you have are cameras. One of the small instruments that goes in has a camera in it that allows the surgeon to see the images inside the body projected on a screen, the way you're having the screens here. So the surgeon is able to now operate on the body, not looking at the body, but looking at the image, using the equipment that is inside the body. That is now laparoscopic surgery. It is not as new as we want to believe in Kenya, because this has been happening since the 19th century in Europe and other, but it is just beginning to gain favor in Kenya, because more and more people are getting trained in it. People are investing in the equipment, and if you go to the private hospitals, a lot of them basically have this equipment. And to be able to see inside this body cavity, the conventional laparoscopy, you had to put in some air inside the cavity. Like in the abdomen, it was carbon dioxide that is being put. Actually, it's still being used even up to now, to expand the cavity, to be able to see inside, so that you can operate.
But with the new change, you're talking about less pain.
Yes.
How does this procedure ensure less pain? And you're still mentioning that what was being used, it was being used then from the 19th century. Has there been any new development? Why are we talking about launch of the laparoscopic surgical unit?
Yes, what has been happening is, first of all, to just say to the advantages that you mentioned about is, most of the pain from surgery is from the incision that you've made. You see, people will be holding on the wound, take a lot of time. We have to examine to find out how long is this wound going to take before it heals, before you can allow somebody to leave the hospital. Yeah. Okay? So with the advantage of laparoscopic surgery is that the cuts are puncture marks. You actually see punctures, so they heal very quick. So a patient spends less time in hospital. So a procedure which will take a patient maybe about 5 days in the hospital, it takes just a day.
Wait, hold on to that thought.
Because of the small cut.
Of the small cut.
Yes.
Now that procedure that was taking 5 days, is this still a laparoscopic?
No. Previously that was open surgery. So what we are doing now is we are trying to give the benefits, because the open surgery is available by all surgeons. All surgeons are trained in open surgery. That's what you went to medical school for.
Okay.
Now, after the general surgery, you are now trying to improve the outcomes from some of the procedures, and in the realization that the less time you spend in hospital, the more you are going to be able to give other patients a time to be able to come, leave the hospital first, go back to your normal income generating activities that are going to build the nation. So the more time, I mean, the less time we spend in giving you your surgical care, the more we give you the chance to go and do other income-generating activities. So that means the hospital spends less on you in terms of equipment, in terms of food, in terms of accommodation costs, in terms of bed stay.
What about manpower?
Manpower now requires a technical skill. It requires somebody to be extra trained in it. So there is an investment in the manpower and resources, but it goes towards ensuring that there are better patients' outcome.
But now the question is, Daktari, does it affect time taken in theatre?
Yes. When you start, of course, there's no what you call a learning curve. The learning curve is the time it takes before somebody has perfected their practice to a way that is equivalent to what was previously there. You understand? Like if I'm doing something in an open procedure, if I now go to begin learning laparoscopy, my outcomes, the time I spend doing the procedure, initially it will be longer than the open procedure.
All right.
But with time, what is called a learning curve, I should be able to get it back to how it used to be before, or even better. Okay, quicker, there's less blood is lost because it is a minimal procedure. There's better visibility. I'm able to have equipment that can handle whatever is happening there. Now, when we talk about a lounge, what's happening here is the conventional laparoscopic surgery uses a gas. We use gas to put in the abdomen to be able to expand the cavity to operate inside.
Still CO2?
Carbon dioxide, yes.
All right.
So that is a gas that is put into the abdomen to expand the space. Now, with gasless, what you're trying to launch is called gasless laparoscopy surgery. Gasless means we are not using carbon dioxide. We do not require carbon dioxide. All we require is the people who are there, who have been trained. We have the equipment, and this, because it's gasless, it can now be taken to all the areas in the village, in the rural areas, which would otherwise not be able to have the carbon dioxide and specialized equipment that requires to be used in that gas environment. So what you're doing is we are doing a very what is called as we are trying to reproduce open surgery through the keyhole surgery of gasless laparoscopy. Gasless laparoscopic surgery. So that is what is a fairly new thing happening, because it has been there in I think Chogoria Hospital have used it for the last 1 year. Nakuru have also used it. I think those are the two hospitals that I can just remember. And this is an initiative of one of my teachers called Professor Jani. Professor Jani is a laparoscopic surgeon who has been doing a lot of work designed to ensure that we have access to good quality healthcare and surgical practices in the peripheries. That is why we have the COSEXA program, which has been spearheaded very much in Kenya by the same good professor, in terms of ensuring that when somebody needs training, they do not need to go to Kenyatta Hospital or to go to a level 6 facility like Moi Teaching and Referral Hospital. We are able to offer training for surgeons in the county hospitals, as long as we have people who are called champions, who can be able to dedicate their time and effort, and we have a conducive environment of the county that facilitates the training. So people are being trained. They don't have to go to another facility for training. They train in the center where they are working. So it reduces the cost of training. And then the equipment, through his organization, the Operating Theatre Practitioners Association of Kenya, OTPAC, which I think he's been chairing since 2017, and when he launched, he has been able to source some donors. Welcome Leap is basically a foreign investment, a foreign company that has been able to very kindly donate this equipment, and will be able to facilitate training of our staff to go for some period of training. And if eventually we are going to have this launched in Kiambu today, hopefully it will be rolled out to the rest of the country, as long as we have county governments that are willing to absorb this program.
So is it a program that is being dispersed from Kiambu level 5, or are we looking forward to seeing it also happening in other hospitals concurrently?
Now,
is it spreading? Or?
It will spread. It's right now. This is I can say it's a rollout program that is starting.
Okay.
Okay.
All right.
And why it's starting in Kiambu is because we have a willing county government that has been working with us at our hospital. We have willing staff. I have to mention one of our 2 laparoscopic surgeons, Dr. Mushuno and Dr. Ndegwa. They have been very much at the forefront because it's in our interest to train the surgeons who are in Kiambu.
All right.
Because once we train them, they will go and work in other parts of Kenya. And these people who are going to work in other parts of Kenya in the peripheries, they will have access, hopefully, with in liaison with the county government and any friendly donors to get equipment.
So you're saying that at the end of the day, this procedure will help the common mwananchi there?
Yes.
Less pain, less time taken in hospital, less money spent in surgery.
For a procedure that was previously available only to a select few in private institutions.
Daktari.
At very expensive costs.
Daktari.
And if I tell you the cost of setting up this equipment, maybe that's something you might want to know. Cost of setting up the equipment, training and everything will cost upwards of 25,000 US dollars. That's about 25 million Kenya shillings. Okay?
So
that is the magnitude.
That was the previous one.
The cost of setting them up is about the same.
Okay.
The difference between the current one and the previous gas laparoscopic is maintenance. Yes.
All right.
It is easier to do maintenance without gas, because when you have to use gas in the abdomen, the gas interferes with the equipment, right? The equipment has to be regularly maintained. You have to have a regular supply of gas. If we don't even have oxygen to keep people alive in hospitals, where are you going to get carbon dioxide to do procedures?
But now this is gasless.
Yes.
Because oxygen, still very expensive.
Yes.
Correct. Daktari, this procedure looks like actually it is a milestone, especially for Kenya as a country.
Right.
Do you, with this, what are some of the impacts you feel like it will make? Is it an eye-opener? Are we foreseeing many other milestones being achieved? Is this a door of opportunity that has been opened?
Very good question, ma'am. And that's a very good and insightful point, because what I say is we are used to this culture of saying tunaomba serikali, okay? Government should just be an enabler and facilitator of people who are willing to provide that extra thing that will add value to the public.
Yeah.
Okay. So when you have people who have the will, they have the determination, they have the partners and maybe the resources to try and provide a useful service comparable to what is being offered in other parts of more privileged Kenyans.
Yeah.
There's no reason why it should be fought.
It should be supported.
It should
100%.
be supported. Yes. So what I want to point out is that when people see such initiatives working in a particular unit in a pilot way, then they embrace it.
Correct.
And that is what we are hoping to achieve in Kiambu as a county. Remember, we did the same thing with the launching of our COSEXA program. It was previously very much dismissed by most of the old school doctors like I who trained in the University of Nairobi.
You know, you're used to a particular pattern.
Way of doing things.
And you don't want that pattern to be interfered with.
So when we make something easily available to people at the lower echelons, or make something very easily available, then some people begin doubting the quality of what is coming out of that. And that is human nature. So what we try to do is we say that we need a few champions who are willing to take the path, let other people see that it's working, and then they embrace it.
And they will come. They will come.
Yes.
And I believe and I hope that this particular procedure will be available in both private and public sectors.
Yes, now
Public
it will be available in Kiambu Level 5 Hospital. Yes.
Daktari, thank you so much for coming. I really, really appreciate the efforts that you've made so far and the steps and the strides you've managed to attain. As we bring this conversation to a close, maybe your parting shot and maybe a word to Kenyans watching us this morning, briefly.
Thank you. I really appreciate the opportunity to come and have the discussion because healthcare is an important component of our life. It's a guaranteed service which is there in our constitution. And we have people who are responsible in ensuring that the service is available to Kenyans.
All right.
We have to play our part as professionals, as citizens, in ensuring that the person who benefits so much is not so much the person who is initiating the project, but the wananchi, the consumer.
Asante.
And when we do our part, it will eventually translate into a healthier society, a more caring society, and a more up-to-date society with the current inventions of health in the country.
Thank you so much.
We work with the government, we work with all stakeholders, and we do what we can when we can.
Thank you so much, Daktari. I wish you the best.
Thank you very much.
Keep doing what you're doing.
Fine.
It's an inspiration.
And we invite you to come to Kiambu. From around 10, we'll be having our launch. Hopefully, if I can get the attention of the governor, I hope he'll be coming to the event.
I hope so. I hope he's watching this morning. That is Dr. Samson Misango joining us today. And it is on that note that we bring, we have a conclusion on this conversation right here on Good Morning Kenya. It was all about matters concerning health care. My name is Ram Maguko, but still, Good Morning Kenya continues. Stick around for more of our programming right here on KBC Channel 1. We are taking a short break. We'll be back with more right here. Keep it Good Morning Kenya.